Discovery Health has confirmed that the Pfizer vaccine efficacy has dropped from 80% in the Delta variant to 33% in Omicron. Discovery further announced that the majority of those in hospitals are unvaccinated. Our reporter Kopano Gumbi is following the story and she joins us via Zoom. So Kopano, what more do we know?
Well, Dudu, I think it's important that we start this conversation with prefacing that this is preliminary information. Discovery telling us that they've been tracking this since the start of the Omicron virus variant, at least entered the South Africa, was discovered in the South African market, which is in the last 3 weeks. So they've been collating this data mostly related to their own members of how their experience has been. And it's a combination of anecdotal as well as clinical evidence. And the 33% drop in efficacy that we talk about is just related to how people transfer or transmit with the coronavirus or Omicron specifically. So what they're telling us is that the Pfizer vaccine has efficacy against spread has decreased from 80% to 33%, but that its efficiency in ensuring that people are not hospitalized with severe cases or die from COVID-19 is still relatively high at 70%. The other point that is of serious concern, at least, and something worth noting, is that the number of cases in children are increasing. And what they're finding is that children as well as adults are going to hospital for other procedures only to be tested, as is routine in hospital, and found that they test positive for COVID, which is a worrying and growing concern. I asked Dr. Gray, in fact, who's part of this study from Discovery, if there is a concern about how easily it spreads if new mutations could be developed. And she said, well, the fact that the positive part of Omicron is that it lasts for a lot less time than what we saw in the previous variations or mutations of the coronavirus, but that the fact that Omicron presents sooner, so within 2 to 3 days, you will start to present symptoms. It lasts a little shorter as well, so that 3-day to 6-day range that you spend sick and presenting symptoms with Omicron, that could in future possibly present a fewer instances of the variant, of the mutation of the coronavirus as we move forward, Dudu.
So it spreads quite rapidly. What did they find when it came to the severity in terms of symptoms that were displayed?
So again, this is part of this evidence that they've released to us today is anecdotal, but what they're seeing and what they say they're seeing from partners in the medical field that they're speaking to is that the symptoms are significantly milder. Most of it is presenting as just a scratchy throat initially, a little bit of a cough, and an interesting development of backache, or what they call myalgia, is developing with this new strain of coronavirus, this Omicron variant. But that generally the symptoms are quite mild, hospital admissions are still low, and deaths from COVID-19 are also low, and they attribute that a lot to vaccine efficiency.
Before a medical insurance company can make such an announcement, I wonder, Kopano, who the stakeholders are that they first, spoke to this about. Was government involved? Was the Coronavirus Command Council involved? Were they consulted?
Well, it's not clear exactly who they consulted, but what we know is that Discovery are the biggest private medical scheme administrator in the country. They have millions of members and they have a wealth of data. So they are very well within their rights to do this kind of research as a private firm in order to develop the research around COVID-19 and how to mitigate the terrible effects of it. But they've also partnered with the SA Medical Research Council. Prof. Glenda Gray is a key part of this investigation, of these insights and the research that they did here in the last few weeks. And so I think the communication and the channels are open, and everybody who needs to be aware of how this virus is tracking is aware of that. And I think that's the most important part, is that we get more and more information about how Omicron is developing, how it spreads and how it presents, in order for us to put in the correct mitigating methods and approaches going forward, Dudu.
I wonder if this issue was touched on in the briefing, the issue of vaccine hesitancy. News like this will no doubt make people even more hesitant, right? So we speak of an efficacy drop from 80% to 33%.
Well, again, it's very important that we put that in context, and that is something that the team from Discovery tried very hard to do, is to say, we have to preface this with the fact that this is preliminary information that we have from the first 3 weeks, as well as saying that the efficacy drop is about spreading the virus, not about it being able to mitigate against severe illness or possible death, which is now the bigger concern around the coronavirus is really quite seriously around how it presents, how you protect yourself, and whether it will lead to serious illness, hospitalization, or death. And I think it's not necessarily related to vaccine hesitancy, but more to say, well, this is the evidence that we have. We have this new approach, which is to offer boosters to people 6 months in, and we know that preliminary research is coming out that demonstrates that with the booster, we find that the efficacy rates go up again, which will help with all of the aforementioned points of not dying, not being critically ill, and not necessarily needing to be hospitalized.
Kopano Gumbi, thank you very much for that very sober reporting.